Hi, my name is Lacretia Roberts, and I am an LMFT intern with the Latte Wellness Group. And today I have with me Laurie Persh, who has a host of credentials and experience in the psychological counseling world. And we're going to introduce her and talk today about how to go about finding a therapist and some of the different practices that you might run into when you're going through this search. So to get us started, I'll let Laurie take it away. Laurie, tell us a little bit about yourself, your background, your experience, and your credentials for this field.
Okay, I am glad to be doing this with Ms. Lacretia Roberts, who has a host of interest and experience as well. I got into the counseling field when I got my master's degree in community counseling in the year 1980. So it's been a long time, and I've seen the counseling field really blossom, and I've had to grow with it.
Mm-hmm.
So some of the things that I have done that have kept me current and interested over the years is to develop a few specialty interests, but also not to stay stuck in doing one single tiny niche area just for over 40 years.
Wow, that's awesome.
So the area, I've maintained interest for helping people. And I've worked in the counseling field and social service field for all that time. I've worked in some different settings, such as inpatient, outpatient, hospital, group practice, and I run my own private practice and training consulting now. After so many years, I've also taught psychology, this topic is one of the things that I've talked about in teaching psychology.
Okay.
And doing some trainings. My specialty areas in providing therapy and supervision and teaching, have been a big interest in cross-cultural work.
Okay.
And I find whether doing individual therapy or couples or family therapy, especially with couples, you bringing people from two different backgrounds. So understanding different cultures is really important.
Absolutely.
I think about those different systems, whether seeing someone as an individual or seeing a family group, because we're all come from some type of system and have to deal with many overlapping systems, whether it's the family or a work system or a government system, whatever system. And then my particular area that I think cuts across that oftentimes when people come for help, about things that they're worried about in their relationship or for themselves and how they're coping. It's trauma, grief, and loss. Many different types of trauma, grief, and loss.
Oh, yeah.
So that's kind of about me.
Okay. That's awesome. Yeah, it definitely resonates with me, especially that piece about trauma, grief, and loss. It is something that, we're finding clients dealing with every day and not having the coping tools and things like that. So these are things that bring people to wanting to say, hey, I need to talk to someone. I need to find someone that resonates with me, that aligns with me. And how do I do that? So I guess the question I would ask you first is, what would you say to a client who is just starting out their journey and trying to find their therapist? And let's say they're dealing with anxiety, they're dealing with depression or post-traumatic stress disorder. What would you recommend?
Okay. Well, the first thing, someone is self-identifying and they've never been to a counselor before. I have anxiety. I have depression. I have post-traumatic stress. one of the things that's confusing in the mental health field is that official diagnoses use words that are part of the lay public, vocabulary. And so it gets really confusing. For example, when people talk about, oh, I'm of a mind to do this, but now I feel like doing that. And, the word schizophrenia or schizophrenic has gotten into the lay public's vocabulary to think it means split personality, and it doesn't at all.
Yeah.
So that's an example of, oh, I'm so schizophrenic about this. But it's
like, wait,
they might be misusing the word. So so when you're talking about anxiety and depression or any kind of mental health problem that becomes severe enough to the point that it's diagnosable, it's not something foreign. Some people are afraid of the mentally ill, that, oh, it's something foreign. I don't want that to ever happen to me. Oh, don't call me crazy. Don't call me mentally ill. But the truth is, what the medical model word of symptoms refers to, and I say medical model meaning we have a comparison with the world of medicine.
Yes.
Because in order to get a diagnosis, in order to get insurance sometimes to cover, and so we use that word symptoms to look at characteristics of a label that could be a diagnosis. And so when people don't want to be associated with that label, they think it's something really foreign. But it gets real confusing because the word anxiety is something, I'm anxious about that, is something that happens to everybody. Everybody gets depressed. Everybody gets anxious. And everybody might have stress that is post, meaning after, the trauma of whatever that stressor was. So it's not something foreign. It's it's along a continuum of, is this dysfunctional for me in my circle? And if it gets to the point that it's dysfunctional for you, that you're doubting yourself, or you're having trouble in your relationships, or you're having trouble sleeping, or your mind is driving yourself crazy, that's the point that you want to reach out for help.
Absolutely.
Whatever the issue is, whether it's anxiety, depression, if it's after some type of trauma event, if it's causing you stress and you don't know how to handle it, a counselor might be able to help. A counselor is not the cure-all for absolutely everybody. Not everybody needs professional therapy. And in fact, if you end up with a therapist who tries to keep you in therapy forever and you don't have a diagnosable severe genetically handed down mental illness, I don't think that's a good therapist, because the counselor's job is to help you get back to functioning so that you can have the right tools and supports without having to always depend on a counselor to push you back up. So that's one of the criterion I would use. So if somebody was looking to get into counseling or therapy, and I'm using those terms interchangeably, if you talk to somebody who just got out of grad school, let's say somebody went to graduate school to become a clinical psychologist, or somebody else went to grad school to become a professional counselor, or even where the terms overlap, a counseling psychologist versus a clinical psychologist. If people are too married to the vocabulary, there might be differences. So the differences there in history, depending on how people trained, Those words, therapy, psychotherapy, and counseling, used to mean something different. The biggest difference is that people who trained and went to school and started out the field of counseling or counseling psychology historically comes from the fields of guidance and counseling, kind of like guidance counselor in a school, which, and in a school, it's working on teaching people to teach, so it's building on their strengths and teaching people how to function better for themselves. Clinical psychology, comes from the background of Sigmund Freud, who was a medical doctor. What's wrong with you? And it builds on what's wrong that needs to be cured or fixed. And that's where those two terms, therapy and counseling, started out being different. But in practice today, people use the terms interchangeably. And so I would say to people, don't get confused by somebody who calls themselves a therapist versus a counselor. So I went off on tangents a couple times.
That's all right. I tracked with you. So to slow that down and just kind of review. So first, you're saying the biggest thing is don't get too caught up with diagnostic terms or clinical terminology. So you don't need a diagnosis to necessarily be able to say, I might need therapy for something, but rather what you want to look for is when these certain symptoms or feelings, you're feeling anxious, you're feeling depressed, because these are normal things, normal experiences as part of being a human. But when it comes to a point that these symptoms are starting to cause impairment, to a point that you're noticing, even for yourself, it's more and more difficult for you to continue doing the things you might normally do. You're noticing a difference on a personal level. For you, I've been sad before, but this is nothing like that. I've never been this upset for this long, or different things like that. That's when you're noticing you might want to reach out. And then the next element or the next step is looking at the different terms that are used when you're starting that search. Do I need a counselor? Do I need a therapist? What is the difference? Does it matter? Where does all of that come from and what is it about? So we're talking about typical, the Sigmund Freud style, sitting on a couch, how do you feel today? Thinking about that and kind of problem solving whatever comes up in the talk therapy style. And then there's more clinical, different modalities come about. So can you tell me some more about those different modalities that the therapist might practice and how and why they might be effective for treatment?
Sure. So I'm going to answer your question, and I'm also going to back up slightly.
Okay.
You're quite right that when you're noticing the difference, it's good for you to go. Occasionally, somebody else might notice the difference before you. So if your family members or friends are saying, "Why aren't you getting out of bed?" or "Why are you so irritable? This is not like you." So that's something I wanted to back up to clarify. Another thing is, in the review, it doesn't really matter if somebody calls themselves a therapist or counselor, unless maybe they're too much of a stickler for it. If you're calling around, even in this day and age of where there's big waiting lists to get into, see a provider, I would still recommend you make yourself a list of questions that you want answered, and you see if the person's going to call you back and talk to you on the phone.
Absolutely.
Because you don't want to waste their time and your time if it's not even foreseeable that it's a good fit. Absolutely. It could take a couple weeks to get an appointment, and then to be shopping around to have 3 different interview appointments. So you want the person to at least call you back and be willing to talk to you for a few minutes.
Absolutely.
So you might, if you're doing online research, you might want to look for somebody who says free phone consult. Not everybody will say that, but hopefully they'll do that. And that if they don't call you back, right now they're really busy. So give them, years ago, I might say you want them to call you back within a day. Well,
Yeah.
maybe you want them to call you back within a few days, because people are so busy, but they do need to at least call you back. If they
Yeah.
don't call you back, if they're that busy that they can't bother to talk to you, or they say, well, make an appointment and don't talk to you, write them off your list.
I love that. I love that. No, it's good. So it sounds like you're saying, and correct me, you want someone who's willing and has the time available to make a connection so that you can really determine whether or not what could be a much longer term relationship, and you being, very vulnerable and being able to trust opening up to this person. You want to be able to see that they're willing to connect. So look for those that have that free 15-minute consultation and are willing to call you back or return a call at least within a couple of days, even if they're busy, as opposed to those who are more quick to try to just get you into their appointment. You haven't met, you don't, haven't connected with them. You want it to be an interpersonal experience for it to be more effective and your ability to connect with the therapist. Is that what I'm hearing?
Yes. And now different group practices or clinics may not have a setup for you to be able to do that. So and so just because that's not the setup, it doesn't mean you can't be a little bit assertive as a client. Now, maybe that's one of your issues, is where you need to build assertiveness. So unfortunately, the client, if you're working on that philosophy that you don't want a therapist, and not everybody does, but you don't want a therapist that's going to act like they're that above you and just say, I know what's wrong with you. I can see it. Do this, that's a very authoritarian, sometimes it's called medical model, but even with the doctors, doctors are being trained better now these days, supposedly to have better, what they call bedside manner, to be more personal. But if you end up with that if that's the kind of person you want, fine. It's not what I recommend, so in the counseling field, it's a shared responsibility when you go for counseling, something that clients should be aware of, that the counselor is not going to take responsibility for your progress away from you, because then you'd never get out of therapy. You're always depending on the counselor. It's the counselor is there to work with you and for you, and counseling is a learning experience. So if you do want to get into counseling, if you're considering it, I think it's a great idea for everybody at one point in their life, at least, because we all struggle sometimes, but you have to be willing to commit to the process and put a little bit of work into it. So that's an important thing to be aware of. And one of the first shared responsibilities of the client is to do a little bit of homework in trying to find the right therapist for you. So if it's a setup, like even that Lati Wellness Group, where there's a big administrative team that's going to help get you to, so you might say who your preference is. You might, say what kind of counselor you're looking for, and be assigned to someone. That does not mean, whether it's Lati or someplace else, it doesn't mean you can't request to have a call back and say, all right, the therapist you're recommending for me, can you have them give me a call before we actually do anything, just to make sure it's a good fit? And I don't know of any place that has a decent counselor that's going to say, no, I'm unwilling to talk to them. All right. So so there's that. Being aware that it is a shared responsibility. So that kind of gets into your question about
Yeah.
different modalities.
Yeah. Yeah.
Okay. The different there, if you think of any math people about like an X and Y, the lines,
Yeah.
that, there's, so there's, um, the one the one dividing line between different kinds of counseling, and I'm not even giving any big name jargon labels to it right
Yeah.
now, is between the kind of counseling that is more present and future oriented versus more past oriented.
Mm-hmm.
Okay. So some kinds of counselors really focus on trying to explore and understand your past.
Okay.
And where and why did this start?
Mm-hmm.
Some, and this is not a hard and fast rule. It's not going to be super black and white. This is leanings.
Yeah.
Okay. Some counselors, with the other side are, where are you right now? What's interfering in what you want for yourself now? What do you want for the future?
Mm-hmm.
That could be true of a counselor or therapist. Historically, the first one leaned more of the clinical, longer term kind of medical model therapy. But it's even in the second half, it's good
Mm-hmm.
to know what reminds you of the past, what
Yeah.
you're still holding on to. Okay, so that's one way that counselors might get that you might divide their styles. Counselors, who are more past focused versus counselors who want to work with the here and now and where you're moving to. So when you make your list of, gee, what questions do I want to ask of my potential therapist? That's a question you can ask. Where do you focus? Do you do you spend a lot of time exploring my past and childhood history? Or are you more focused on what they call the here and now?
Mm-hmm.
Okay. You might have a preference for how you want to be in counseling. You might want to give the counselor a try to see, if you don't know for sure. All right,
Yeah.
so that's maybe the X coefficient. The the past versus present and future. The other big dividing line
Mm-hmm.
is between the the terminology is called directive versus non-directive.
Mm-hmm.
Okay. And basically it's who's the captain of the ship, who's directing this process.
Right. Right.
Okay. So the directive leaning therapy is where the therapist is directing what happens in therapy and telling you more what to do.
Yeah.
And I want you to do this. I want you to do that. Answer me this. Answer me that.
Mm-hmm.
The non-directive leans more towards the therapist being a mirror to what you bring to the session. It kind of sounds easier for the second kind because you don't have to be as prepared. You might think you don't have to be prepared to go to counseling. With one or the other that, I don't have to do much.
Mm-hmm.
But they're both styles. The client is still a partner with the therapist.
Absolutely.
The one that is not that's directive, your therapist might be more willing to answer some direct questions. So think of that word directive. Your therapist is willing to answer some direct questions and provide some more guidance to you. And I have found that most people coming to counseling want some answers. So I probably lean a little bit, me personally, I lean a little bit more towards the directive style because I'm not afraid to answer people's questions.
Yeah.
Okay. And I don't want to be frustrating the client to simply reflect back what the client's bringing. I want to help get things moving. That's my personal style. On the other hand, having the empowering the client to see what the therapist is seeing, and for the therapist to be patient with you and trusting in you, that being very empathetic, helping you see how you're coming across is very, can make you feel really cared about, really more confident that they trust that you're going to find your way. So there are pros and cons to both. The one that's non-directive is sometimes very frustrating when you're not getting the answers so quickly, from the therapist who doesn't want to give any opinions, but just tries to reflect back. So those are two kinds of general categories with modalities. The other thing I will tell you, like I was saying before, don't get too hung up on the labels. You might see many, and get yourself all excited if you're doing research about types of therapy. Oh, this kind of therapy for this problem. A lot of sophisticated clients have heard of CBT, cognitive behavioral therapy. It's something that's used. It's something called evidence-based because it's been researched a lot. There's some problems are more amenable to that than the other. But along with cognitive behavior therapy, which stands, CBT, there are many, many other alphabet letter soup of different types of therapy. You might see different whole bunches of initials behind people's names.
Yes.
You might see, oh, this kind of therapy works for this. I talked about trauma. There's I call it fringe, but it's not so fringe anymore. It's called EMDR. It stands for eye movement desensitization response. People have to get special training to be able to do it. Basically, it is a technique that a counselor studies and has to be certified to be able to apply it well. And it's just one of many techniques. It doesn't mean if you can't find that kind of therapist, you're out of luck. Even if you're psychiatrist or doctor who did not really focus on how to do counseling. Psychiatrists focus more on medication unless you get one who went for further training in how to do counseling, or a medical doctor. So they can be just as vulnerable to the publicity about all these alphabet soup things as you are, or I am. And so they might say, go for EMDR training. So if you can't find it, don't worry. It's just one of many types of techniques that helps to interrupt the cycle of repetitive, intrusive, or traumatic thoughts. Whether it's a flashback kind of thought or it's a obsessive anxiety kind of thought. It is a technique to interrupt that broken record kind of problem. But there are other techniques. So my conclusion about that is don't get hung up on the labels. No matter what the alphabet soup is, back to your list of what you want to ask questions about is, do you have a specialty? Do you have a favorite kind of therapy? If so, why? What's been your experience? These are some questions for when you're looking for a therapist that you might, what's been your experience? Do you, what's your average length of stay for keeping clients in counseling? Might be a question you want to ask.
Mhm.
You might also, if you're looking for counseling for a problem with a boyfriend, girlfriend, partner, spouse, what's your experience working with couples? Right now, my partner's refusing to come anyway, so I don't know that it matters, but it'd be good if you understand about working with couples.
Mhm.
So if you're having a particular relationship issue, you would probably want to see somebody who does understand that and might help you bring that partner in to the counseling session.
Yeah.
If you're having issues with kids,
Mm.
you're a parent,
Mm.
do you want your child to be in counseling, or do you want some parenting coaching so that you can learn what to do with your child, or maybe family therapy? And there are pros and cons to those different approaches, but you might want to talk to a couple of therapists with those different kind of approaches: individual for the child, parenting coaching, family therapy, and have them explain why they believe in those approaches so you can decide where you want to start.
Gotcha. Okay. So you've given us so much valuable information. So backing up just to review, so you're saying when it comes to modalities, there's tons of different ones. You're going to hear a lot of terms: CBT, DBT, A, B, C, D, E, F, G. No, I'm just kidding. But it gets really overwhelming and confusing, and so you don't want to get too caught up in necessarily the terms, but rather reaching out to that therapist and just asking them, in your experience, what has you motivated to do things the way that you do? And how long is it going to last? What am I in for, basically? What am I getting myself into if I start therapy with you? How do you do this therapy? Making that connection with them and finding out for yourself is going to be a key to you being able to see, okay, does this work with me? Does this fit what I feel like I'm needing personally? And there's a lot of different ways that a therapist might reach that through these different modalities. So it's really just up to you. It's down to your choice and what you as a client feel aligns with the therapist that's in front of you. And so my next question, and what this takes me to, is how do I know when it's okay if to say that this isn't for me, this isn't a match, I don't think that we align, I need something different? Or if I do like the therapist, but don't feel like they're challenging me, or I don't feel like I'm getting out of it what I need, how do I go about communicating that? Or is that okay to communicate to my therapist?
Okay, great question. In the beginning, when you're first starting, okay, when, of course, you're going to try to get some of your questions answered over the phone. You can at least get some feel if you're comfortable talking to the person, or if they sound like they know what they're talking about. They've answered your questions from your list, Then once you meet them for that first time, I would say if getting to match up with a therapist is a little bit like dating.
Absolutely.
So when you go on a first date
Mm-hmm.
and you leave that first date, I don't know if anybody has had this experience. So, depending on what your age is or if you've dated, who knows. But for most people, the first date might be, wow, that was wonderful. And they get their hopes all up.
Yes.
That might be one extreme. The other extreme, oh, I know that's terrible. Oh, never again. Most first dates are somewhere in the middle, and they give the person a few dates before they decide whether they want to hook up or keep trying, or it might turn into something more, but they give it a few tries. So that's what I'm going to recommend to you, is that if you have one extreme feeling or the other, if it's the extreme feeling that you hate them, of course, you're not going to return.
Right.
If it's the extreme feeling that you get your hopes up, how wonderful that you're hopeful. I don't want to burst your bubble, but it probably isn't going to be like that every single time. But it's still nice that you got your hopes up and, you know, that you had that good feeling in the beginning, you know, and if you don't have either extreme, give it at least 3 times.
I like that. That's a rule of thumb.
You know, because you don't want someone that you're going to connect with like it's your best friend, because, well, some people go to therapy who don't have friends, but with the majority of people, you have had at least, you know, a lot of people go to therapy and they do have maybe 1 or 2 friends, or they have had a good friend in the past or a relative. And if the therapist talks to you like they're your best friend or your relative, what do you need the therapist for? So you want to have a decent enough connection, but still feel challenged.
Okay.
So give it a few times. All right. To answer your question about what if you're already in counseling and you don't feel like it's working and it's been a while, well, maybe you've reached kind of like a plateau. Anybody ever go on a diet and it starts out working really well and then they reach a plateau? Well, it's either your level and the combination of you and the therapist, you've kind of fallen into this rut, or in the diet world, your body has fallen into a set point rut and you have to change something. Ideally, the therapist is going to recognize it, but therapists are human. And so if you recognize it first, it's not moving fast enough, or something's not working. Back to that beginning thing that I said about my personal philosophy, and remember, you know, and I will say this is my personal bias, you know, is that the client shares some responsibility. So there is absolutely nothing wrong if you're the first one as the client who recognizes it not working to bring it up with the therapist. Don't just simply say, oh, that therapist is terrible, and drop out. You know, it's maybe the therapist was being patient and thought that that was the pace you wanted to go. And that if you feel, it could be that it feels to you like you're a rut, but it feels like to the therapist, oh, you're at a steady level. Let's keep it steady for a while. You know, and so you have to communicate. No, I'm ready to move forward and let's do something different. I'm getting tired of this stability. I want to be moving differently. So there's, you know, so it really does behoove the client to speak up. If that, you know, if that therapist suddenly went off the rails, they have their own personal issues that they are dealing with and gets defensive. And, you know, what do you mean you don't like what's happening? You know, or you don't like my style. Well, you can go elsewhere. Well, if that's how they respond to you, go elsewhere.
Yes, definitely.
But anybody can have an off day. You know, so if they weren't that extremely bad in acting therapy, but maybe they have a personal issue, you might want to say to them, if you're the client, I don't know what was going on with you last week. I tried to bring something up and it seemed hard for you, and you're supposed to be a therapist. So, you know, just even though it's a relatively artificial relationship in the sense that it's not, you know, it's it's supposed to be a one-sided, but not exactly, because it's 2 human beings. And it's still, there are overlaps in relationships in the rest of your life. So some of those overlaps in relationships with the rest of your life is that you don't write people off for one mistake. You're never going to have a relationship with anybody if you don't give people a second chance. Now, if they repeat that a couple times, maybe it's not a good fit. All right. I am watching the time, and I think we have covered a lot, Miss.
We have.
Roberts. So I don't know if
Yes.
you have any final questions or review to sum up what we've been talking about.
Yeah, no, I think this is great. Really informative information. It's given a very different perspective coming from your experiences, and I think it'll be really useful to people that are thinking about it, or people that are on the fence, people that have that anxiety and they don't know what to expect or what to look for. These are some things that can really help you cross that bridge and go from, getting the help that you really need versus just thinking about it, moving into that action stage and making that progress. So I really want to thank you for taking the time to talk with me and meet with me. Love learning from you, love hearing your perspectives. There's so much I know that you have. So I'm ready to soak it up. So hopefully we'll see you on here again. But for now, thank you again. And until next time, we'll meet up and we'll be talking about something different.
All right.
So,
Well,
thank you.
good luck to everyone in their counseling journey.
Thank you. Thank you.
Okay.